Victoria is the only state that's had 4 lockdowns of this kind. Why are we getting contact tracing so wrong?
So that's an absurd proposition.
But why don't we have
contact
enough faith
tracing,
in our contact tracers
sorry, to
so
finish,
that we don't force
it's an absurd proposition that contact tracing has gone wrong. We've talked about exactly what the contact tracing team have done here. It is an extraordinary job. Contact tracing is an integral part of how to get control. It does not do magic. Every country in the world started with 1 or 2 cases in their countries and had contact tracing that could have worked within those limits. But that is not the whole story with contact tracing. And most countries in the world have had huge epidemics. When you've got an individual who's not infectious, who happens to have breached out of hotel quarantine and they're in the community, if they're not infectious, there's nothing to respond to. You can do contact tracing, but if they haven't transmitted to anyone, I think that was the case in Sydney. Despite being a confirmed case, no transmission within the household to the very closest contacts. If someone's not infectious, there is nothing to respond to. If you've got someone who's incredibly infectious, and we've had a case in this outbreak, and they've been around and about, as most people move in Australia now with the settings that we have, there is an enormous opportunity to transmit to many, many other people.
There's some kind of communication breakdown though.
How are sorry, I'm going to ask one. Would you like me to ask?
Yeah, Michael, and then I'll go back to you.
How are we going identifying a link to the original wallet case? Are we still looking for that? And what impact, if any, will that have on getting on top of all of this?
We'll continue to try and find links, because if we can find a link, then we know if there are other people exposed and therefore who need to be in quarantine and getting tested. But, you know, detailed interview and re-interview hasn't identified the exact link. We know that genomics says that it's come from that wallet case from South Australian quarantine, but we'll continue to explore. It would be great if we know those links, as I say, but if we don't, it's really just a case of encouraging everyone who's symptomatic to get tested.
So there's some kind of communication break. Just following on from that question before, there's some kind of communication breakdown going on here though, when you've got businesses that have been called exposure sites telling customers before Victoria Health gets to them. We've got thousands of contact tracers across the state. Why are we not getting on top of it quicker?
So it's entirely appropriate. This is a collective effort. It's entirely appropriate for businesses with the channels that they have to contact all of their clients and customers when they know that they're an exposure site. We'll do the double and checking of details to get it up on our website, and people should check that. But when a setting knows that it's an exposure site, and they will have their own mechanisms. They've got their own Facebook pages, Instagram pages, they've got their client and customer lists, and they can email en masse and they can provide that information. They will do and must do that as we formally put the exact times, verified, and exact locations on our website.
Do you agree that that's confusing though for people?
We have to do everything in parallel at the same time.
Why not before?
All efforts need to be made. So if there are social media channels that businesses have, they can and should and really must use them because there'll be some people who do not check websites. There'll be some people who will turn up at a setting and see the sign on the door. So we have to use all methods and media.